Thank you for joining us for the Eliminate Your Student Debt, Empower the Community, Federal Scholarships and Loan Repayment Programs webinar. I'd like to highlight a couple housekeeping items for you in Zoom. The features available to you can be found at the bottom of your screen. While the chat button is disabled, if you have any questions during today's presentation, we ask that you type them into the Q&A pod located at the bottom of the screen. Please note, federal staff are standing by to go over questions, and not all questions will be answered in the order in which they received. Thank you again for joining us today. We hope that you find the webinar incredibly helpful. Now I'd like to turn things over to Melissa Robinson. Melissa?
Yes, thank you, and good afternoon. Again, everyone, thank you for joining us today. Like Carl shared, my name is Melissa Robinson. I'm a management analyst with the National Health Service Corps. I'm joined today by my colleague Kendrick Neely, who is also a management analyst with the program, and Clark Conover, a supervisor with the Division of Regional Operations. You can access all of our bios by clicking on the link shared in the chat. Next slide. For today's agenda, you will hear about the collaboration between tribal communities and the National Health Service Corps. We will go over how our programs can help eliminate school debt, what is the process to become a National Health Service Corps approved site, the support and resources we have available for you. You will hear a testimonial from one of our awardees, and then we will take time for questions and answers. At this time, you will hear from today's co-host, Rory Collins, who is with the Public Health Council at the National Council of Urban Indian Health.
Hello, everyone. My name is Rory Collins. I am a member of the Nana Native Village, which is Tanana Athabaskan, Alaska Native tribe, and I am the Public Policy Counsel at the National Council of Urban Indian Health, or affectionately called NHCSC. And so I would like to first just thank HRSA for inviting NHCSC to participate in today's panel and to share more information about UIOs as we discuss the importance of recruitment and retention of providers throughout Indian country. And we hope you'll consider one of the 41 UIOs as a potential service site in addition to our partners at IHS and tribal facilities. So I'll just give a very quick background about NHCSC. NHCSC is a national representative of the 41 urban Indian organizations, or UIOs, contracting with the Indian Health Service under the Indian Healthcare Improvement Act, or called ICHIA. Today, over 70% of the Native population lives in urban areas, and our mission is to support the development of quality, accessible, and culturally competent health services for Native people living in urban settings. And UIOs pursuant to ICHIA are Native-controlled nonprofit organizations who deliver healthcare and referral services to Native people residing in urban centers in which the UIO is located. UIOs play an important role in addressing health disparities for urban Native people, and they're a critical part of the Indian health system, which is comprised of IHS, tribal facilities, and urban health programs which is collectively called the ITU system. And UIOs provide critically needed care to urban Native people, primary care, behavioral health services, social and community services, and traditional healing and medicine to Native people living in urban areas. And there are 41 UIOs that operate 85 facilities in 38 urban areas across the United States, and they're also in 11 of the 12 IHS service areas. And collectively, UIOs serve patients from over 500 federally recognized tribes. And because UIOs are considered an auto-approved site by HRSA for the NHSC Scholarship and Loan Repayment Program, we highly recommend that you consider UIOs as a potential option when you're considering service placements. And so it's just a very short blurb from NHCSC, and so I would just like to say thank you to HRSA again and the NHSC for your continued partnership and the opportunity to share the importance of UIOs in serving Native communities who reside in urban areas. And we look forward to a continued collaboration in recruiting and retaining providers to serve Indian country. And if you have any questions, please feel free to contact NHCSC at policy@nhcsi.org. NHSC.org, or my email at rcollins@ncui.org, and I'll just put it in the chat for everyone's reference.
All right, so thank you, Rory, for sharing the information with us and all our attendees. So the National Health Service Corps is focused on building healthy communities, and we do this through a number of programs that support qualified healthcare providers who work in areas where there's limited access to care. The program has more than 1,800 providers dedicated to serving over 19 million patients in underserved communities by providing primary healthcare, dental, and behavioral health care. The NHSC program continuously expands and adapts its clinician support to address public health crises that are directly related to its mission to provide quality care. The National Health Service Corps includes both scholarship programs and loan repayment programs, which we will cover in greater detail throughout this webinar. Next slide. Our program has kept Indian Health Service funding as a priority for several years now, and we have dedicated funding just for providers who are serving in Indian services facilities, which includes awarding those working at low-scoring HPSA sites. Please know that from the set-aside funding for tribes, in the last few years, we have not depleted our funding. And since we have not depleted our funding, we have not received enough applications to award the remaining people that are interested in applying. So please apply for our program. Next slide. This slide shows a snapshot of the demographic breakdown of the National Health Service Corps compared to the national physician workforce. The National Health Service Corps has a higher proportion of providers that represent different racial ethnic groups. Drawing your attention to the 0.3% of the national primary care physicians that are American Indian and or Alaskan Native. And within the NHSC program, American Indian and Alaskan Natives are 1.6% of our providers. Since dedicated funding, NHSC has doubled the number of physicians working at Indian Health Service facilities. Next slide. Over the past several years, the loan repayment program has continuously awarded many providers. As you can see from the breakdown of awards made between 2019 and 2023, we have made a total of over 1,500 awards across Indian Health Service facilities, tribally operated health programs, and urban Indian health clinics. Next slide. The NHSC model leverages a variety of recruitment and retention methods that are committed to identifying skilled primary care workforce and placing them in areas where they are most needed. In fiscal year 2023, the program received over 9,000 applications and awarded just over 6,500 applicants. Our Student to Service program, also known as S2S, serves as a hybrid program to both the scholarship program and the loan repayment programs. We received about 280 applications, and we were able to award over half of the applicants. Then there is our second largest program, the scholarship program. We received about 2,900 applications, and we made 180 awards. So as you can see, this is a highly sought out program. Next slide. Now that we have reviewed information about the Health Service Corps and how we have impacted communities across the nation, let's take a closer look at two of our programs that are focused on students who are pursuing their health professions degree. Next slide. For the NHSC student programs, we have two types of student programs. We have the scholarship program, which is a 2-year service program. And we have Students to Service program, which is a 3-year program. Okay, next slide, we're good. The National Health Service Corps Scholarship Program award scholarships to students pursuing eligible primary care health professions training. This is a minimum commitment of 2 years with a maximum commitment of 4 years. The program pays for tuition. It provides a monthly stipend for living expenses and an annual financial assistance for other expenses such as books and health insurance. To be eligible for the scholarship program, students must be a U.S. citizen or national, must be a full-time medical or dental student that is enrolled and fully accepted into an accredited school located in U.S., D.C., or a U.S. territory. Students must be enrolled in a program pursuing one of the following disciplines: physician, dentist, nurse practitioner, certified nurse midwife, or a physician assistant. Next slide. So today's webinar is perfect timing to talk about our Students to Service program. We are currently accepting applications through November 7th. We are offering Q&A sessions for those interested in applying. With one of them, we are hosting tomorrow from 10 a.m. to 5 p.m. Eastern Time. You can visit our website for additional details about attending the webinar. For our S2S program, we offer up to $120,000 in tax-free loan repayment for 3 years of full-time service and 6 years of half-time service. After your initial commitment with S2S, you as a participant can apply for a continuation award as a clinician via our NHSC loan repayment program. You will hear more about the clinician programs in a few. For S2S, this will be a program that is for your last year pursuing a degree in medicine as a physician, dentistry, or nursing. Please note the postgraduate training requirements. Physicians must complete an accredited primary care residency, an approved specialty. This is going to be internal medicine, family practice, pediatrics, OBGYN, psychiatry, or geriatrics. For dentists, nurse practitioners, and certified nurse midwives, you are encouraged to complete an accredited postgraduate training. However, it is not required. Next slide. To support maternity care target areas, also known as MICTAs, we are offering an additional $40,000 supplemental award. It is our goal to encourage maternity healthcare providers to work in a MICTA, and this is an added perk that is separate from the $120,000 award. To be eligible for the MICTA award, you must be one of the following disciplines. You must be an OBGYN physician or a family medicine physician who regularly serves as an OB, or you can be a certified nurse midwife. You must have unpaid qualified school loans, and you must make a commitment to provide primary care in a MICTA with a shorter score of 16 or above. Let me provide a quick example. A program participant is awarded $120,000 in the S2S program, which ends up being 4 annual payments of $30,000. And then they are awarded the $40,000 MICTA award, and those are dispersed on an annual basis at $10,000. So then in the end, you as a participant would be receiving $40,000 each year. At this time, I'm going to pass the presentation over to my colleague, Kendrick Neely.
Thank you, Mel. Let's now take a look into the 3 various clinical loan repayment programs from the National Health Service Corps. Next slide, please. First, we have our 2-year traditional loan repayment program, for which this coming year will be our 2nd year to include an award increase of up to $25,000 for primary care providers. Therefore, primary care providers may receive a maximum award of up to $75,000 for a full-time service obligation and $37,500 for a half-time service obligation. These primary care providers include physicians, nurse practitioners, certified nurse midwives, and physician assistants serving in a primary care HIPSA or maternity care target area. Please note that if your qualifying loan amount is less than the maximum award, the NHSC will only pay for the current balances of your eligible loans at the time of your submitted application. Next slide, please. For all other eligible disciplines outside of the primary care providers, other eligible clinicians may receive a maximum award of up to $50,000 for full-time service obligation and $25,000 for half-time service obligation in exchange for service in an area that is defined by a health professional shortage area. This is the highest need area that is defined by a HPSA score ranging from 0 to 26, with 26 being the highest possible score. This means that priority is given to applicants serving at a site with the high HPSA score. Also, it is important to note that the participants of the 2-year loan repayment program are eligible to apply for a 1-year continuation contract as long as they have eligible remaining student loan debt. Next slide, please. As part of HHS response to the opioid epidemic, we have 2 NHSC programs that focus on expanding and improving access to quality opioid and substance use disorder treatment in underserved areas nationwide. Healthcare clinicians qualified to provide substance use disorder treatment may receive student loan repayment in return for their service at an NHSC approved site. Applicants from the NHSC approved SUD treatment facility may receive priority if they serve in an opioid treatment program or are certified in substance use disorder interventions, such as a master's level substance use disorder counselor. The SUD program offers up to $75,000 for a 3-year service obligation and $37,500 for a half-time service obligation. Unlike the 2-year loan repayment program, the SUD program does not offer a continuation contract. All applicants must be trained and licensed to provide SUD treatment at an NHSC approved SUD treatment facility. Next slide, please. Additionally, we have our Rural Community Loan Repayment Program. The Rural Community Loan Repayment Program is similar to the SUD program. However, clinicians must be trained and licensed to provide SUD treatment at an NHSC approved rural SUD treatment facility. Also similar to the SUD program, applicants in the Rural Community Program are not eligible for a continuation contract, and the award for the Rural Community Loan Repayment Program is up to $100,000 for a 3-year service obligation and up to $50,000 for a 3-year half-time service obligation. Please note that the SUD program and the Rural Community Loan Repayment Program do not offer repayment options for dentists or dental hygienists. Next slide, please. General eligibility requirements for all NHSC programs include all NHSC participants must be United States citizens or nationals. They must be trained and licensed in an eligible discipline approved by the National Health Service Corps. They must be licensed to practice in a state where they have obtained their licensure unless they are working at a federal prison, Indian Health Service facility, or tribal site. Applicants working at any of those facilities can be licensed in any state. At the bottom of the slide is a comprehensive list of our eligible disciplines. Please note the marking for additional disciplines included for the SUD and RC loan repayment programs. Next slide, please. We strongly encourage you to apply for the loan repayment program that best suits your needs. As the loan repayment program benefits include providers receiving a loan repayment in addition to a competitive salary from their employer by following 2 simple steps. 1, the provider finds a job at an NHSC approved site, and 2, successfully submit an eligible NHSC application. For assistance with these 2 steps, you may watch the NHSC site video on the HRSA YouTube channel and find positions by utilizing the Health Workforce Connector. Next slide, please. Also, during today's presentation, we want to highlight and promote one of HRSA's programs that is not an NHSC program, but managed by the National Health Service Corps. The Pediatric Specialty Loan Repayment Program is authorized by Title VII of the Public Health Service Act and is a program that was launched to expand and improve access to care by recruiting and retaining clinicians who demonstrate and are interested in delivering pediatric medical subspecialty care, pediatric surgical specialty care, or child and adolescent behavioral health care. Next slide, please. Some examples of eligible pediatric specialty disciplines are physicians, psychologists, psychiatric mental health nurse practitioners, and licensed professional counselors. Please note that when it comes to subspecialties, there are many qualifications or qualifying disciplines such as child abuse pediatrics, pediatric emergency medicine, and pediatric hospital medicine. And for behavioral health, there are subspecialties such as clinical social workers, marriage and family therapists, and psychology doctoral interns. You may visit the website for a complete list of eligible subspecialty disciplines. Next slide, please. Benefits for the PSLRP program is that this helps to remove financial barriers so that clinicians may be able to provide services in high-need areas. An eligible applicant may receive up to $100,000 in exchange for a 3-year service obligation of full-time, as this program does not offer a half-time option within it. This award is in addition to receiving a competitive salary from an employer and should not be taken into consideration when establishing pay and benefits. The PSLRP award is taxable and federal taxes will be held prior to disbursement. The award is also subject to state and local taxes and will count as wages under the Social Security Act. Next slide, please. I will now turn the presentation over to my colleague, Clark Conover.
Thank you, Kendrick. My name is Clark Conover. I am the supervisor for the areas of Denver and Kansas City, overseeing the 10 states, which includes quite a few sites in Indian country. And we'll talk about site information, AKA, is your site eligible? Next slide. The short answer is yes. Right now, there's 574 federally recognized tribes in the country. All of the sites that are serving those tribes, along with the federal Indian Health Service facilities, 638 critical access hospitals, all the urban Indian clinics, mobile clinics, school-based clinics, everything is in our system currently. There's 1,068 sites that are currently National Service Corps eligible in Indian country, with 819 as of a week ago providers under National Service Corps serving at those 1,068 sites. Next slide. All Indian country ITU sites are auto-approved. It's very simple. If you have a site that is seeing patients in primary care, medicine, behavioral health, or oral health care, you can log into a BHW customer service portal. Select apply for NHSC, follow the necessary drop downs, complete the remainder of the application, and that gets sent to us. We will confirm it's part of a federally recognized tribe. This may be a satellite of an existing program. It may be a new site. The application will be submitted for review, and you will be auto-approved to become a National Health Service Corps sites and become site number 1069. And then hopefully we will add more and more sites every year as sites increase and access increases in Indian country. Next slide, please. We have many supports and resources. Next slide. This includes the Workforce Connector and clinical profiles. What you put in your auto-approved sites goes right to the Health Workforce Connector. This lists your job vacancies, the ability for you to boutique the connector and come up with absolute great opportunities. We know that the majority of clinicians that are looking to come to your sites are accessing Health Workforce Connector and your web pages after hours, during call, after they're in school. So the more robust Workforce Connector, which is free to each site in the National Service Corps and all recognized tribes, federal Indian health facilities, and urban Indian clinics, your word can get out to those clinicians. Next slide. And again, you get to boutique your site profiles. It's super easy to do. You just go on, follow the prompts, and put the pictures in, put the videos in, everything you want, you can put in that site profile. Next slide. Virtual job fairs, great opportunity. The National Service Corps Nurse Corps does annual virtual job fairs. This is a chance for you as a site to meet clinicians that are looking to come work in Indian country. Save the date for the next job fair. It's November 20th. There'll be a call for applications for the sites to apply. It is limited. So we encourage you, as soon as that application, the call for comes out, that you apply to become a virtual job fair site. Next slide. And there's our contact information: Facebook, Twitter, LinkedIn, all the sites, and it's in the chats. Please go. Any information that you saw here today, you can find more information online. Next slide. I'm going to turn over now to Dr. Sean Ludlow, introduced by our good friends at the Division of External Affairs, and about his awardee story.
Thank you, Clark. Hi, this is Sharon Saunders. I'll be moderating and interviewing throughout the remainder of this webinar. So pleased to have you all. On the screen now is Dr. Sean Ludlow, and we're going to do a quick interview with Dr. Ludlow to hear a little bit more about his experiences as a National Health Service Corps awardee. So, Dr. Ludlow, so pleased to have you. Thank you so much for being here. Can you tell us a little bit about yourself?
Thank you for having me. I first and foremost want to tell people my story about how thankful and blessed. Can you hear me okay?
Yes, you sound great.
Thankful and blessed to have this loan repayment program award. It has changed my life drastically. I want that to be the first and foremost part of my story. I will say that I grew up in Southeast Oklahoma. I'm a tribal member of the Choctaw Nation. My story, as I remember from being a little boy, is living on the land in Southeast Oklahoma, which is the allotted land from the Removal Act in the 1800s, where my family still live. I was raised by my great grandmother. She was very instrumental in my raising, and she was one of the very first generations that was born on the land after the Removal Act in the 1800s. And so I think it's realistic to know she heard a lot of the stories, and they weren't nice stories. They were terrible stories, and she had this deep-seated mistrust of anything Western, Western medicine, Western people. I can still remember her words. In Choctaw, the word is Nahulo, and that's white. And it hurts me even today to know that she had this such deep-seated mistrust. And I will say that she is forever ingrained in my memories and in my mind, and even today, it's emotional just speaking about her, because she was such a wonderful influence in my life. She is where I have my faith today. She is why I love today. And everything that I do is in honor of her. But I can remember as a 9-year-old boy, I walk into her room, and you have to understand, back then, it's still in the mid 70s. And so we're about country, we're about hunting and fishing. We still live mostly off the land in that time, and we weren't very rich, but we had love. We had our family, and she never wanted to go to town. So what I would do is I was kind of the intermediary. I would ask grandmother what she wanted from town so I could get it for her. And this one particular day, she wouldn't answer me. I still see her face wanting to speak to me in Choctaw, but she didn't. And a 9-year-old boy doesn't understand. I was frustrated. And so I went to my parents, and she died just shortly thereafter. And for a 9-year-old boy that had her grandmother as his whole world, my world was flipped upside down. Now I see family members I've never seen before in years, and in a moment's notice, she's gone out of my life. And so I learned from that time later that she was self-caring for a necrotic breast mass. She was taking care of herself in silence. She suffered in silence because she didn't want Western medicine. And so, from that hypercoagulable state, as we know in medicine, she had a stroke, and it was devastating, and she died. So, in honor of my grandmother, I have made it my life's mission to try to bridge any mistrust, not just for the Native communities, but for everyone. And what do we all want? We want someone that loves them, that they can trust. They want to be heard, and they want to feel that they're in a safe place. That's across races. And so, in honor of my grandmother, that's why I went into medicine. And to this very day, I am so proud that I can still speak about my grandmother, Harriet Ludlow, because today I'm her legacy. My children are her legacy. And so I am so passionate about what she taught me. And still, even though she had the mistrust, she loved. And so I'm going to expound on what she taught me, but I'm going to love, because I've learned what Western medicine is. I've learned that this can help. And so sometimes, unfortunately, we look at the color of our skin. And when I see my tribal members come in, I can see it on their face that they wanted to see a brown skinned person. Okay. But and it's difficult to really articulate, but on a grander scale, it's just about treating everyone else like you want to be treated. And going through this process of obtaining my goal of being a physician, I accrued so much debt. And so, in accruing all of this debt, my primary focus has been to get that job that has the highest paid salary. That was my main focus. I wanted to pay off this mountain of debt that I had. And I feel like I lost my first love, because don't get me wrong, I'm so thankful for the places that I've worked. I've met amazing people. I have them as, in my life even today. But when I was able to get this loan repayment program award, now I realize how much stress that debt was just hanging on me. And so when that part of my life, that debt, that part of that stress was taken away, then it gave me the freedom to go back to my first love, and that's to work in my community and to love on the people that really it reminds me of my grandmother. So I can't stress enough how that allowed me that avenue, that freedom of choice, because when you look at the disparities in wages from a corporate entity and the federal, it's vast. But when I have my loan repayments taken care of, and when I came to Citizen Potawatomi Nation and worked in their tribal facility and having my health insurance paid for, that disparity, that vast divide in the wages narrows significantly. And I just want to tell everybody I'm living my best life now. And I wish I had done this before.
Dr. Ludlow, I'm practically speechless. I got chills listening to your story and can't tell you how much I appreciate you sharing something so deeply personal with all of us. I think we will leave here today just so enlightened, and just, having such a new perspective on things. So thank you for that. I want to talk a little bit about this, your education and kind of what how you got to hear and learn about the National Health Service Corps program as an option for you, because you're educated. It sounds like you went and did some other work that wasn't close and near and dear to your heart, but somehow this program came to your awareness. So tell us a little bit about that.
Rear Admiral Watts sent out an email. This was years ago. And I became aware of this email through my medical director. And he said, you might want to look into this. And it was something foreign that I could apply and actually get some aid in paying off my loans. Because when you reach a level of a wage and a yearly salary, the tax credits go away, and you're faced with trying to take care of your family. You're faced with paying your loans and not be late, and sometimes even in a doctor's salary, things can get a little tight. And I went through that process that was very thorough but straightforward. And when I was awarded that, I can't impress upon how much stress that has gone away, how much stress has gone away from that. And knowing that that wage disparity narrows, and now you have this thought that, well, maybe I can work where I want to in my community and love on the people that I wish I had done years before. It was a door that was opened and I walked through it.
Sounds amazing. And it sounds like you've had an opportunity to continue your service past your original terms. Can you tell us a little bit about reapplying and, recommitting yourself?
What's amazing to me is, and I don't know if I should be really sharing this, but this is where I want to spend the rest of my life, in the workforce. It's so amazing to me that this, irrespective of receiving this award, this is where I want to be. And being in a place where you want to be for the rest of your career, and then also getting aid in paying off that last remainder of the debt, it's just such a bonus. And I can't thank HRSA enough.
I mean, you just always want to hear that, and your community has got to be so grateful to have you there. And the fact that you were able to reapply for additional loan repayment funds and extended your contract. It just seems like it worked out perfectly for what your goals were. So can you tell us a little bit about, your day to day? What's it like where you work, and, you're getting to love on people there?
Well, I have to apologize too. You may be hearing some ruckus outside. I'm in my office at the urgent care facility at Citizen Potawatomi Nation. We're here in Shawnee, Oklahoma. And so my day, I think the blessing is I have been in the corporate world. I have worked in many of the emergency departments, and I personally feel I'm kind of at the tail end of my career. The emergency, the trauma, I've kind of want to kind of go out of that sector, although I still am credentialed at many of the ERs. But this is an urgent care, primary care hybrid where I've been able to use my experiences of trauma and be able to see patients in the urgent care settings, knowing that some of the patients, they just know they don't feel well. And the first knee-jerk response is, I'm going to urgent care. Well, sometimes these complaints require a higher level of care that urgent care cannot give. But I'm in a unique position where I have so many options. I can start an IV, I can draw blood, I can do an x-ray, I can get a CAT scan. And those, sometimes I have not used the MRI uh, 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 perspective here in the urgent care because that's a little bit deeper, but I still have that, and our primary cares that work here have that at their disposal. So we have so many ancillary opportunities to use for our patients, and for some of those, I can kind of stretch it and use it maybe as more of an ER setting. And if I can identify something, then I can do the referral myself. But again, that's a little difficult to navigate sometimes, because sometimes it is better that they go straight to the emergency department. But that's what we do here. We take care of runny noses and ear infections and lacerations. And I saw a head injury on a kid yesterday that we helped him navigate from a football injury. And we just, it's, the beauty is I still get to see that aspect that stresses my emergency, emergency evaluation. But I've got that safety net where, okay, we can call an ambulance and send them to the ER as well.
Well, I want to thank you so much again for sharing your deeply personal story, for telling us about your NHSC experience. We are so proud to have you as one of our awardees, and thankful that you were able to join us today. So why don't you stay on camera? I'll ask some of the other presenters if they can come back on camera. We're going to open up our Q&A at this point in time. You're welcome to, as we previously discussed, there's a Q&A button at the bottom, and you may click on it and you can type in your question that way. And we will either respond to your question via a text back, or we'll take your question and we'll have one of our presenters answer it verbally. Very pleased that we were able to get some questions in advance. So while we're waiting for those questions to come in, let me throw a few of the questions that you all, some participants shared in advance. All right, so for our program folks, for the loan repayment program folks, disciplines, we're interested in knowing about eligible disciplines for the programs. So specifically, veterinarians, nutritionists, chiropractors, ER physicians working in an ER room setting.
Unfortunately, none of those disciplines that you just named are eligible for any of the NHSC programs. At this time, I would encourage individuals to look at HRSA for any other additional funding opportunities. But at this time, none of those disciplines are eligible for any of the NHSC programs.
Thank you, Kendrick. Okay, another question, when do the applications become available for these programs? So we've got 3 programs we talked about today. When can we start applying for these programs?
Yeah, so I'll speak to that. For the loan repayment program, we have not announced our application cycle dates yet for new awards. you can sign up for email to get program updates. Usually or generally, our window time can be late this year or early 2025. So there is a window there, but that's why it's most important that you sign up for our email, so then you get the alerts, so then that way you are best prepared for when it opens and you can submit your application. I want to add, if you visit the website, it'll say it's closed, but all the criteria is there. So that way you can get the mindset of like what you need to gather, what documents or whatnot. So how you can work with your employer to prepare that, you can share that you're interested in applying and how they can support you. So you should go ahead and visit.
All right, Melissa, thank you. These two questions we received are somewhat similar, so I'll ask them both. I have student loans from LPN school from 2018 to 2019. Can I still get loan repayment for those? I have, second question, I have student loans from obtaining my associate's and bachelor's degree 6 years ago. Can I get assistance with paying those off?
So yes, those loans will be eligible at the time of application, because if this is your first time applying for our program, those loans are eligible. The only time that those loans would be ineligible if you come back for continuation and you did not initially submit them with your initial application.
Okay, so the associate's and bachelor's degrees from 6 years ago, you answered that question as well?
Yes, that will be encompassed in all of their loan, as long as they meet if they're eligible discipline at the time, that will qualify as well. I want to add here, Sharon, but we do not do what is those? I'm going blank with the loan.
Melissa wants to help.
I know,
Yeah,
I'm like,
yeah.
I know. Parent plus loans. We do not
Parent
do
plus
parent
loans,
plus
correct.
loans. So
Correct.
Good to
Thank you.
know.
can I add, so we are aware that people consolidated because there's the public loan forgiveness program. And so we've had people that they're applying, and we saw that you can contact your lender and separate the parent plus loan out and still consolidate your other loans. So again, so that's something you can prepare to separate it, so that way your loans are eligible to apply.
Wow, that's great. All right. This question might be for Clark. I work in a state agency that serves tribal populations. Would I be eligible?
For the National Service Corps program, state agencies are currently not eligible. I assume we're not talking about tribal health departments, but more of a state.
Clark, we can't hear you. Can other people do?
If you could speak up a little bit more, that would be great, Clark.
All right, I'll apologize. If you're working in a state agency, state government, for example, you're not eligible for National Service Corps programs. If you're working in a tribal health department, you very well may be, especially if you're an RN or nurse practitioner, very eligible for the Nurse Corps Loan Repayment Program. But as far as a state health department, state health and human service department, state agency, they're currently not eligible for this program. There are other federal programs you may be eligible for, but not through HRSA.
Okay, thank you, Clark. Yeah, we are having a little bit of a challenge with the volume, but we'll push through. Okay, so another question I think for our folks that has to do with I'm currently in service under the Students to Service Loan Repayment Program. Is there another program I can sign up to pay for my remaining school debt?
If you're in the Student to Service program, you may transition to the traditional loan repayment programs, any of those, the 2-year SUD or RC program, if you meet eligible requirements for the SUD or RC, but you are more than welcome to apply to the traditional 2-year loan repayment programs.
And you said RC, you mean the, can you give the full name of that?
Rural Community Loan Repayment Program. Thank you, Sharon.
Kendrick,
Sure.
and they're eligible for those programs the day after their student service commitment ends, correct?
That's correct, Clark. Thank you for adding that.
Yes, just Kendra, can you repeat what he said? Just because his volume's a little bit low.
That individuals the day after they end their student to service contract, they're eligible to apply for the NHSC program.
Thank you. Thank you. Okay. Yes. I'm just checking the questions that have come in. One, I currently work at a tribal facility as a pharmacist in an urban area, but it's not SUD or rural SUD. Would I still be eligible for loan repayment?
Okay. Oh, I can take Kendrick. Okay, so for the pharmacist not in our general or a traditional 2-year program, we do not, pharmacist is not an eligible discipline. So
Thank
if
you so much.
I'll share this real quick. So if you are a pharmacist and you really are like, I want to pursue a loan repayment program, and if you're open to, going to a different site, you can go to the Health Workforce Connector and see sites that are eligible. Help me out, Craig. Which pharmacist is which?
So basically, if you're a pharmacist, you must work at you must be in our SUD or RC program. And if you're eligible, if you're looking to transition, you will have to work at one of those facilities to be eligible for funding.
Understood. Thank you. We had another question come in through our Q&A pod, and please continue to post your questions there. The question is, I am currently a nurse manager for a tribal health facility, and I am in an FNP program. I am scheduled to graduate next year in October. Should I wait until the next cycle to apply for the loan repayment program? Can I use the IHS loan repayment program and combine it with the HRSA loan repayment program?
You want me to take it?
Go ahead, Mel. Go ahead.
Okay, so sorry. So for right now, if you're in school for the nurse practitioner program, you would need to wait. I would encourage you to get licensed first since you're graduating in October, and then apply to the next cycle. As I forgot what the second part of the question was. Like, I don't see it anymore.
And the second part of the question had to do with the IHS.
Oh, okay.
Can
Yeah.
you combine the
be-
two?
Okay. No, you cannot. So you would have to either participate in the IHS loan repayment program or with the NHSC loan repayment program.
I think this might be a good time because we did get a question asking how are the two programs different? The National Health Service Loan Repayment Program, how is that different from the Indian Health Service Loan Repayment Program? And we do have a comparison chart, and that's just been dropped into the chat. So not only do we have a comparison chart for the loan repayment program, but also one for the scholarship program. So take a look at those files that have been shared in the chat. You can download them, and then you can take a look and get a deeper dive into the differences between those two programs. You mentioned something about licensure. So there were two questions around that. I'm an associate clinical social worker. Last year, I tried to apply and was told I had to be licensed. Is this still true? And then the second question is, can I obtain clinical licensure using the funding for the program? And I can repeat those questions if you need me to, but the first one had to do with needing to be licensed.
So to be eligible for any of our NHSC program, you must already be a licensed clinical social worker to receive funding.
Excellent. Okay, so then you cannot use the funding to obtain your licensure because you already have to be licensed, correct?
You already have to be licensed, correct?
Okay, thank you for clarifying that for us. A question for Dr. Ludlow. You applied to the program a few times to initially and then to get continued service. What's the most challenging part about applying for the program?
I think for me is I was out from graduation. I graduated med school in 2004 and then my residency in 2008. So it had been several years and trying to compile all of the loan debt. That was probably the most challenging part of it, but it was all still straightforward and very doable. But I think that was my hardest part was getting all of that together.
Okay, good. Thanks for sharing that. For Clark, a question for you. As a site or as a clinician, the employer has already set up or is already set up under a status that's other than ITU. Do they need to do anything to be placed under a category to make them site eligible?
Well, the question, if you can hear me, so the question is, the site does not identify itself as an Indian or tribal unit, so 638, a federal IHS, or an urban Indian clinic, correct?
I think they already are set up as that.
Okay.
What else do they need to do?
The site, as long as it's active, does not need to do anything else. If the site's not active, then we need to find out why. And they certainly can, I'll put my email in there and they can certainly contact me directly and we can troubleshoot. There are some Indian Health Service, IHS, urban Indian clinics that are not eligible for the program. That is if you're such as residential care, such as 638 operated hospitals, such as Indian and tribal correctional facilities. But if you're not one of those categories, the site should be eligible and active. And if not, we'll find out why.
Thank you, Clark. Yes, there is also been dropped in the chat information that you can go to online to get, your questions answered as a site. But I think Clark is also dropping his email in the chat. We are coming down to the last few minutes here. Let's see, we do have another question, a couple of questions that have come through. I'm working on becoming a registered dietitian. Would I qualify then?
I can take that answer since I am a registered since I am a registered dietitian. So unfortunately, National Health Service Corps, we are not in their discipline, but strongly encourage registered dietitians working for IHS urban and tribal facilities to check out the IHS enrollment payment program. I am a recipient of that and very blessed and thankful that they offer that.
Thank you so much, Kathy. I appreciate that. All right, so let's see if we have any other questions coming in. We do have a question about the webinar being recorded and available to watch at a later time. And yes, this is being recorded. All registrants will receive information on how to access the recording. They'll get a copy of all of that information. We also have a website where that will be posted in the next few days. So you can also check the chat, which has basically recapped what I just said. So are there any other questions before we close out today? You want to move to the next slide? And I want to thank everyone for coming today, and especially thank all of our presenters and for Dr. Ludlow and sharing his story. Thank you all so very much. You all are able to connect with HRSA and learn more about our agency by visiting www.hrsa.gov. While you're there, you can sign up for our HRSA e-news, press releases, and other information on that site. Or you can also choose to follow us. We're on Facebook, X, Instagram, LinkedIn, also on YouTube. So please do check us out, follow us on our social media channels. And if you're looking for current positions that are open to work at HRSA, you can take a moment, you take your phone out and scan the QR code that is currently up on the screen. So I want to officially thank everyone again for attending today's webinar. We appreciate you, and we hope that you all will look into our programs and apply in the near future. Thank you and have a great day.